ICU, force a PEG tube and transfer to LTAC without family consent. That's what I will be discussing today. My name is Patrik Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence, even if you're not a doctor or a nurse in intensive care, making sure your loved one is always getting best care and treatment. So today I have a question from one of our clients, TK, who's in the US, who says, "Hi, Patrik. I'm reading your team's emails, but I'd like to fully understand from your perspective in speaking with your team what's happening with my dad. I can see the test results, but not the notes. They want to know my reasons for not wanting to do a PEG tube. The doctor said that they would push forward with sending him to an LTAC. They are planning to step him down to high dependency, step down ICU soon. Now, also the palliative care doctor says that they don't have any other place in the hospital that will treat him while he's on a ventilator. I'm also reaching out to an attorney so that I can get guardianship and conservatorship over my dad so that they won't try and force me legally. I'm trying to fight the hospital the best I can, and sometimes it's draining, but I usually regroup and continue to stand strong against them." From TK. TK, thank you for reaching out, and I can hear how exhausting this battle has become for you and also for your mum. You're fighting the good fight, and what you're experiencing is unfortunately all too common in ICU settings across the United States. So let's look at understanding the ICU's push for PEG tube and LTAC transfer. So let me break down what's happening here from my perspective after working with thousands of families in your exact situation. And whilst we're consulting families in intensive care all around the world, the largest group is in the US. So, we're dealing with this all day, every day. So the ICU is pushing for a PEG tube and LTAC transfer because of, number one, financial pressures. Your dad likely exceeded his DRG days, diagnosis-related group days, meaning the hospital is losing money keeping him in ICU. Number two, bed availability. They need the ICU bed for other patients. Number three, standard protocol. One size fits all. When patients can't be weaned off the ventilator and the tracheostomy quickly, ICUs in the US default to PEG tube placement and LTAC transfer as standards of care. Like I said, one size fits all, and it never ends well. Patients are not one size fits all, they're individuals. So here's what you need to know about your rights, TK. In the United States, hospital cannot legally force a PEG tube placement or transfer without consent. However, they may have significant leverage and will often make families feel like they have no other choice. This is where having proper documentation and legal standing becomes critical. Like I've been saying here on this channel for over a decade now, hospitals are very good at pretending they can do whatever they want. Well, nothing could be further from the truth. Right? The minute you stand up, you will see that the dynamics change. But stand up intelligently with advice, with consulting, with intensive care insights that we have at intensivecarehotline.com. That's the right way to do. So you also need to get access to all medical records. This matters greatly because you mentioned you can see test results, but not the notes. This is a massive problem. You need access to all medical records, including doctors, nursing, progress notes, respiratory therapy notes, all consultation reports, imaging reports with interpretations, pathology and lab trends over time, arterial blood gas results, ventilation settings, vital signs, and the list goes on, fluid balance charts. You need to leave no stone unturned. Because these notes contain the hospital's reasoning, concerns, and plans. And you will also find out when you look at the notes more closely, you will actually find out whether they're telling you the truth or not. We are finding all the time that when we look at medical records, the hospital is not even telling you half of what's going on. They're trying to create a narrative without you having access to all medical records, and that's when things go pear-shaped. You need to create your own narrative. Without access to medical records, you are flying blind. Under HIPAA laws in the United States, you have the legal right to access these records, especially if you're the healthcare power of attorney or next of kin. So Here's what you should do immediately. Submit a formal written request to the hospital's Health Information Management Department for complete copies of all medical records. Give them a deadline. They must provide these within 30 days. I wouldn't wait 30 days if I was you, though many hospitals can provide them faster. Some states have expedited timeframes. Now, also, let me highlight the value of a consulting call with myself or with one of our team members. This is exactly where a consulting call with myself or the intensivecarehotline.com team becomes invaluable. We can, number one, review the complete medical records and identify what the hospital isn't telling you. Number two, prepare targeted questions for the ICU team that they must answer. Join the family meeting or conference call with the ICU team to question their recommendations in real time. Advocate on your behalf using medical terminology and evidence-based arguments that command respect. Challenge the necessity of the PEC tube and LTAC transfer if it's not in your dad's best interest. When families have an expert advocate on their side who understands ICU medicine, ICU nursing inside out, understands family rights in intensive care inside out, and speaks the language of the intensivists, the ICU nurses, the respiratory therapists, suddenly the hospital's urgent timelines become negotiable, alternative options appear, or the timelines disappear altogether. Been there, done that. Have a look at our testimonial section for results. So let's look at addressing the PEC tube question. The ICU wants to know your reason for refusing the PEC tube. Here are legitimate medical concerns you can raise, but even so, you don't have to raise them at all. It is just your choice. Don't over-explain yourself for something that you don't need to explain to them. Number one, there is an infection risk. PEC tubes carry risks of infection, peritonitis, complications. Also, it is a surgical procedure. Keep that in mind. And the surgical procedure costs money and poses a risk. Next, if your dad ends up with a PEC tube, it is much more likely that he will go to an LTAC because most LTACs will not take nasogastric tubes, right? So, and that is everything you also need to know about LTACs. If they can't look after a nasogastric tube, it should greatly concern you about the skill level they're offering there. Next, you think it's a premature decision. If there's any chance of improvement, why rush to a permanent surgical procedure? Next, quality of life concerns. PEC tubes are uncomfortable and limit mobility. Alternative feeding options, nasogastric tubes, nasojejanostomy tubes, or even TPN, IV nutrition in some cases. Now, let's also look at the LTAC reality the hospital and the ICU isn't telling you. Here's what ICUs don't say. LTAC facilities often have worse outcomes than hospitals. They have lower staff-to-patient ratio, way less experienced respiratory therapists and nursing staff, no ICU experience from my vast experience. ICUs often push towards tracheostomy and long-term ventilation without aggressive weaning attempts, and that continues then in LTACs. Also, LTACs can be a one-way ticket where patients rarely return home, often die or stay there indefinitely. Now that your dad is in ICU, now is the time to wean him off. They have the right skills, they just don't have the right mindset. And you're well within your rights to question a transfer to LTAC. The fact that they're planning to step him down to step-down ICU suggests your dad may not even be stable enough for LTAC. So why are they even rushing? I've made a video a few years ago with the title 10 Reasons Why LTACs in the US are a scam. And I stand by every word that I'm saying here. Go and check out that video so you can get more information about LTAC and why to stay clear of them. I also urge you to have a look at LTAC reviews online. That will paint the picture for you. We've also had so many case studies over the years, horror stories from families out of LTAC. It's all documented here at intensivecarehotline.com. Guardianship and conservatorship, protecting your rights. TK, reaching out to an attorney for guardianship and conservatorship is a smart move. In the US, if you're not legally designated as the healthcare decision maker, hospitals can challenge your authority, go to court to appoint a guardian and override you, make decisions that override your wishes. Having legal guardianship means you have the final say on the medical decisions. The hospital cannot override your refusal of the PEC tube. You control the timing and destination of any transfer. You can demand second opinions and alternative treatment plans. This legal protection is essential when dealing with ICUs or hospitals that are pushing their agenda rather than honoring patient and family wishes. Next, let's look at the alternative here as well, which is intensive care at home. Here's what the palliative care doctor at the hospitals aren't telling you. Your mother doesn't have to stay in a hospital or LTAC to receive ventilator care, or tracheostomy care for that matter. At intensivecareathome.com, we help families bring their loved ones home with full ventilation support, including long-term mechanical ventilation in the comfort of your own home. Tracheostomy care with trained ICU nurses only. 24/7 ICU nurses if needed. Aggressive weaning protocols where appropriate that many hospitals, ICUs, and LTACs won't attempt. Palliative care where appropriate in a peaceful home care environment if that becomes the appropriate path. These options allows you to keep your mother out of ICU predictably and permanently, avoid the LTAC nightmare, maintain quality of life and dignity, have family present 24/7, pursue continued improvement without hospital pressure. Many families don't know this option exists because hospitals never mention it. They assume ventilator care requires hospital or facility-based care, but that is simply not true. So let's look at your action plan. Immediate steps. Request complete medical records in writing from the Health Information Management Department. Continue refusing consent for PEC tube placements. PEC tubes have their time and their place, but in your case, it would just push your dad to LTAC. Next, document everything, every conversation, every pressure tactic, every timeline they give you. Accelerate the guardianship process with your attorney. Schedule a consulting call with myself to review the medical situation and prepare for the next family meeting, or prepare for a call with the doctors and nurses. In the family meeting, we ask these questions. What is the specific medical indication for a PEC tube right now versus continuing the nasogastric tube? What happens if we transfer to LTAC and my dad's condition worsens? Where does he go? And I can tell you from my extensive experience, he will bounce back into ICU in no time, often within 24, 48 hours. And then patients bounce back into a different ICU because the discharging ICU no longer has beds. And that means critically ill, vulnerable patients end up in 3 different locations in 3 or 4 days. It is madness. Stay clear of it. Next question you need to ask. What aggressive weaning protocols have been attempted and what's left to try? Why is LTAC the only option being presented when home ventilation with intensive care at home exists? If we refuse the PEC and LTAC transfer, what is the alternative plan? Now, standing strong, you're not alone. TK, I know this is draining. You're fighting a system that wants compliance, not partnership. But you're doing exactly the right thing by questioning, researching, and refusing to be bulldozed. The fact that they're threatening legal action tells me they know their position isn't as strong as they're claiming. If it were truly a medical emergency, they'd act. Instead, they're trying to pressure you into consenting. Remember, you have the right to refuse treatment. You have the right to second opinions. You have the right to explore all options, including intensive care at home. You have the right to take the time you need to make informed decisions, have peace of mind, control, power, and influence, making sure your dad gets best care and treatment always. At intensivecarehotland.com, we've helped thousands of families navigate exactly this situation. Like I said, a consulting call with myself or one of my team members will level the playing field with the hospital, provide you with medical ammunition to support your position, question the hospital's rush to PEC and LTAC, explore whether your dad is a candidate for intensive care at home through intensivecareathome.com, and it'll give you the confidence and clarity to stand strong and keep fighting. Don't let artificial hospital timelines and pressure tactics force decisions you're not comfortable with. Get expert guidance before consenting to anything irreversible. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotland.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotland.com, and you can verify it on our intensivecarehotland.com podcast section where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.